Greetings to everyone. My name is Ashiluma, the project coordinator of the FAFA Research Foundation, specifically located in Boya, southwest region of Cameroon. I'm here to tell you a little bit about the FAFA Research Foundation. So the FAFA Research Foundation is a non-profit, youth-led, non-denominational organization, which I earlier said is located in the southwest region of Cameroon. It has as area of focus, firstly, healthy living and mental health, secondly, strategic partnership, thirdly, sexual and reproductive health and rights, fourthly, we also have capacity building and community development, and our motto is redefining and promoting research. Why did we land at this conclusion of redefining and promoting research? We came to realize that most youth take research more like a school requirement and have little or no interest about research. So the FAFA Research Foundation came in to be able to empower these youth, and throughout its journey and throughout its existence, it came to realize that most of these youths, especially in the southwest region of Cameroon, are suffering from mental health issues due to the crisis and even some battles at home, not only in their community. And that's where now it gave birth to the Promehy project, which is promotion of mental health amongst youth. With partnership with Grand Challenges Canada, we have been able to impact the life of youths to be able to boost their mental health, so that all together we can work in the world of research and promote healthy living in our community.
I am Nganga Jamin Nganga, a public health expert and a project manager at the FAFA Research Foundation. So the FAFA Research Foundation is currently operationalizing a project titled Promotion of Mental Health Amongst Youths, which goes by the acronym Promehy. So this project is being funded by Grand Challenges Canada, and it targets young persons and youths between the ages of 10 to 24. So this project is being implemented in some selected communities and schools. So at the level of the schools, we have guidance counselors with lived experience, and while at the level of the communities, we have peer educators with lived experience. So in terms of the communities that we are working with, we are looking at Boya, we are looking at Tiko and Limbe 1. Then for the schools, we selected 5 schools wherein we have Bilingual Grammar School Moliko, we have GBHS Limbe, GBHS Mutengene, GBHS Tiko, and GHS Bokwango. So generally, the objectives of this project are as follows. We are out to create mental health awareness amongst youths. We are also out to provide psychological first aid. We also want to improve access to specialized mental health care services, and also want to provide virtual support and communication as far as the project is concerned. And last but not the least, we are transforming the culture of mental health by demystifying mental health illnesses. So for successful implementation of this project, the FAFA Research Foundation understands the fact that we cannot do so alone, and that is why we are having stakeholders. And the stakeholders that we are working with as far as this project is concerned, we are having the Ministry of Public Health, we are having the Ministry of Youth and Civic Education, Ministry of Social Affairs, and Ministry of Secondary Education. We have also identified some partner organizations who are into mental health to also be able to reach out to this huge number of youths in the southwest region. And by so doing, we are talking about the Cameroon Baptist Convention Health Services, the CBCHS. We are also talking about DIBA Holistic Mental Health Care. We are also talking about Leslie Foundation. We are talking about the Creators Initiative Organization. And with higher institutions of learning, we also incorporated them into our list of partners, and we have partnerships with the Faculty of Health Sciences, University of Boya. We have partnership with Rahis. We have partnership alongside with St. Monica Higher Institution of Health Sciences and St. David's Higher Institute of Health Sciences as well. So far, we have had some significant results for the project, and remember, this project is being operationalized in schools and communities. So at this community arm, we have been able to enroll over 1,754 youths, and we have been able to provide more than 2,300 counseling sessions. So we have also had 4 tours in these communities highlighted, whereby we reached out to 1,200 youths, and we have also been able to refer some of these youths with severe mental health problems to our clinical psychologist team, and we are looking at more than 500 of them. So at the level of the schools where we work with our guidance counselors, we have been able to enroll over 1,670 youths, and they have been able to receive over 2,500 counseling sessions. And one unique innovation of our project implementation in schools is that we have been able to establish mental health clubs, and these mental health clubs are being run or are being supervised by the mental health ambassadors who report to our guidance counselors. So we have been able to have over 300 members in these guidance counselors in these mental health clubs, and likewise we'll be able to have up to 32 ambassadors who are leading these clubs. So basically, and in summary, that is the Promehy project.
Hi everybody, I am Nupakawa Christelle, Research and Publications Coordinator at Lifafa Research Foundation. Let's talk about mental health disorders in youths. So the World Health Organization reported that 1 in 5 youths suffer from mental health disorders. It's one thing to write an article, and it's another thing to publish that article. And at the Lifafa Research Foundation, we've been able to publish over 2 articles on mental health disorders in youths aged 10 to 24 years. In one of these articles, we realized that 23.9% of youths suffer from anxiety, and about 29% suffer from depression, while 30.1% suffer from suicidal thoughts. This may sound as a trend, but it's a serious call for concern, and it's a crisis. Youths go through a lot of academic pressure, media pressure, societal pressure. This causes a lot of stigma and prevents them from opening up and seeking for help. Publications give insights as to the consequences and causes of certain conditions. As a research expert, I've seen firsthand the kind of impact a well-researched, informative paper can give. The mental health of these youths is not a personal issue, but it's a societal imperative. That's the reason why by promoting informative publication, we can help break down the barriers these youths face and empower the young people so they're able to have a brighter and better future. Publications are not just words on a paper. They're powerful tools for research, education, advocacy, and awareness. These publications have been written in clear language, and they are very well accessible online. We are calling on researchers, practitioners, policy makers, family members, friends to share our publications so the youths can be aware of the mental health disorders that surrounds them and the challenges they face. Mental health issues in youth are a pressing concern that requires urgent attention. So what can we do to help these youths facing mental disorders or going through mental health challenges? We can advocate. We can create safe spaces for these youths to open up with their feelings to us. We can support organizations who work on mental health in these youths.
Of our community tour, we have had several community tours. We have had one community tour in Boya, specifically in the Bokwango community. We've equally had a mental tour in Limbe one. We've had another mental tour in Siko. This was a huge success. All these stores were huge successes in the fact that we had partners we reached out to, which collaborated with us and we could feel the youths, because this project we are dealing with youths aged 10 to 24 years old. So the impact was great. The youths were happy. During these stores we had resilience building sessions, we had mindfulness therapies, we had hugging therapy sessions which were done, and the youth were very happy because mental health is still an aspect of health in the society, specifically in Cameroon, which is still stigmatized. So people were aware of the fact that they had mental health issues, and it was equally all our talks ended with counseling sessions by our clinical psychologists, whereby these youths met one-on-one with our various clinical psychologists and they were given counseling sessions. The memorable events of these stores were seeing these youths open up, telling the clinical psychologists that various problems we encountered scenarios where youths will open up, youths will cry, share stories and scenarios they have not shared with anyone. So this was really amazing. The attendance was great in Bokwango, in Limbe, and in Tiko. It was amazing. The youths were there, the children were there, and it was really a success. So the community's response to these tours was good. The fact that they attended the event and the feedback, because we always do short interviews to know the feedback from those who attended our event, and it was great. The youths were happy. Some had never participated in events as such. They were very happy. They expressed themselves. They spoke to our counselors, and you could see the relief, the smile on their faces.
We also had a mental health tour in the Tico, in which we also had a good number of participants come out with the help of the community youth leaders and other community stakeholders. The highlight of this particular tour was the presentation from one of our partners, also the representative from Baptiste CBC, the mental health unit in CBC, Motengene, who created awareness on common symptoms and warning signs of mental health disorders amongst youths, and how to seek for help and support when these warning symptoms come up. So mental health tour in Limbe, which also drew so many participants within our age range, 10 to 24. We also had community stakeholders, the chiefs, the community youth leaders, and other notables around the venue where we had this tour. We had interesting activities from our team, and our partners always available to support us with additional activities. One of the highlights from our partners during the Limbe tour was a presentation by Madame Mercy of Prime Counseling, and she demonstrated a lot that happens amongst youths, especially when it comes to communication, effective communication amongst youths, being able to communicate their emotions, their behaviors, their thoughts, and being able to confide in loved ones, especially their parents and guardians. Looking at our peer educators in the communities, our selected communities, we worked with a number of peer educators who facilitated our penetration into these communities, and they help us easily access participants. They also helped us easily get to the stakeholders. They are the ones that facilitated most of our interventions, maybe getting to these participants and helping us come to them for screening and counseling. We also had resilient building sessions in trying to help these youths or help participants be able to cope or manage their daily stressors, and to find easy links in finding support when it comes to mental health challenges, be it in their daily activities or family or home challenges from home settings. Our peer educators also helped us carry out referrals, sending some of these community participants into our office located at Great Support Street, opposite Team Bookshop, where we did some counselings and follow-ups of these participants who had mental health disorders. During our tours, we also had great awareness sessions, creating more awareness on mental health disorders, especially amongst the youth, and linking them to how they can easily find support and cope with mental health challenges. We went to churches and some gatherings on days where we were opportune, and this was a great avenue for us to continue to create awareness on mental health disorders. And also in collaboration with community stakeholders, quarter heads, and the youth leaders, we were able to get authorization before getting into these communities. And we had a number of follow-up sessions with a good number of participants who had mental health issues or challenges after our screening. We had a number of counseling sessions with these individuals which were very satisfactory. Some ended up in a satisfactory recovery state, some whose recovery was still in progress, and some who were making applaudable efforts towards recovery or towards positive behavioral modification. Looking at the school arm of the Promehy project, it has been a good and applaudable collaboration with the school guardian counselors in our selected schools. We worked with the guardian counselors to get authorization to work with students in these selected schools, where we started by having awareness sessions and creating mental health clubs in our selected schools. So we are happy, and we have activities that we follow up with these club members during their weekly club activities. Some of these activities include peer-to-peer education on mental health, where youths from the mental health club go ahead to mobilize or sensitize other students on the mental health issues and simple ways to manage or coordinate themselves in the school milieu when it comes to improving mental health. We also had activities like drawing, singing, dancing, mental health quizzes, and brain trust activities, in which club members participated so well and were very interested in carrying out these activities. It will be interesting to note that these club activities are going to continue even after the Promehy project, because we've tried to establish mental health ambassadors in all of these schools, where in all of our selected schools, in which case the school ambassadors and the guidance counselors, they are going to continue the management of the mental health club to ensure that students' mental health is taken note of in the school milieu. Some of the activities we also carried out in schools, like screening, resilience building, especially for vulnerable groups and students who identified as internally displaced, maybe due to the ongoing crisis. We had resilience building sessions with these students. We also had screening and counseling sessions for students who had mental health challenges or issues. So we've had a series of follow-up sessions with these students, some of which were remarkable, some short progress in recovery, some short behavioral changes as the counseling sessions were ongoing, some short reluctance, after which they were able to pick up and follow up with these sessions satisfactorily.
Greetings everyone, my name is Brain Cassier, a volunteer at Lifafa Research Foundation. I'm privileged to be a volunteer during the ongoing Promehy project, that is promotion of mental health among youth with the ages of 10 to 24. As a volunteer, I joined a team that facilitated workshops, seminars, webinars. We also brought up educative activities on mental health to boost the mental health of youth, to provide them with solutions. We went to schools, and in the course of the project, I saw first-hand impact the Promehy project had on the students. Students they were very comfortable opening up about their mental health challenge, and they were grateful with the support we provided. From there, We continue to go through our tours where we're able to provide mental health materials, one-on-one support on the street, and that gave relief to the young people we encounter. Personally, to me, the experience was a transformative one because I gained valuable knowledge on how to go about mental health awareness, how to go about mental health tours. It was a personally transformative session for me because I couldn't find myself creating a positive impact in the life of young people. But with the coming of the Promehy project, I was a solution to young people out there. Overall, I would say we need to create facilities on mental health to help young people, not just young people, but the society at large. We need to create a safe and a conducive environment where young people feel free to talk about their mental health, where they can gain solution with their mental challenges. I think with this field, we can move a mile, we can move a distance with this. To crown it all, the Promehy project has actually made me mentally stable with the minor mental health challenges I had. Thank you.
Okay, my name is Bingoin Prudencia. I'm from the Boya community. I'm a student in FHSUP. I'm currently taking my master's program. So I came to learn about the PME project through my friend Island Faith through our conversation. From our conversation, she had to introduce me to the program since at that point in time I was going through stress, through depression. Due to the current state that I was like, I faced a lot of accident, like a missed accident that actually put me through trauma. So my conversation with her and the advice she gave me, I was able to overcome this stress or this trauma during that period. So from there, she introduced me to their program and joined me to their community chat. In that chat and from their the conversation and the educative talks that I've actually been carrying out in the group that actually helped me build my mind, not only about the mental stress that I was going through, but it has made me to learn a lot about so many other things about the reality of life. What actually piques my mind was about the suicide. We were talking about how to manage, like, be around those people that commit suicide. Actually, from the lesson and the chat on what they told us that day has helped me a lot because now, suicide comes with a lot of stigma. So that day, after the conversation and the lesson, I was able to reason, to be around someone that has tried to commit suicide, or advice, or now I can talk to somebody that is having a mentality of committing suicide and direct the person from that direction, thanks to the program. Okay, what advice I can actually give out there is drugs. You need to reduce the consumption of drugs because drugs actually steps or change the state of mind. It make you see things in a way that is not the reality. So if through the Promehy project, they are able to reduce the number of youths that consume drugs, it's actually going to help.
I am Madame Ebai Clarice Ashu, a guidance counselor working with GBHS Mutengene, and I'm a counselor working with the Fafa Research Foundation under the Promehy project. So far, my experience working with the Fafa Foundation under the Promehy project, which is promoting mental health among youth, has been of a very great success to me, to the school, and to the society. That is in promoting mental health of our young people in the society. I've gotten experience that I've been able to impact on the students to talk to them, and I've been able to solve their problems, and I think their mental health is now very, very stable. We did this with counseling, with resilience, with the creation of the mental health club, with counseling, and the feedback we got, I think, was very, very great. So I'm encouraging other schools who do not have the mental health clubs in their institutions that it is a very good thing for them to create one, so that they will be able to build their students not only socially, academically, but psychologically and also all around, for them to become successful people in the future. As we know, our youths are the leaders of tomorrow. So to be somebody tomorrow successful, you need to have a good mental health. So I'm encouraging all of our youths to keep up with the strong mental health. And I'm also thankful to Lifafa Research Foundation for giving me this opportunity. We are also thanking even the partners, Grand Challenges Canada and Grand EFIS Canada. Thank you very much.
My name is Mai Anita. I'm a mental health ambassador from GBHS Tunde. I am here to talk about how the mental health has impacted me with knowledge. As a mental health ambassador, I am able to stand up on my weakness, and I'm able to acknowledge my strength, and I'm also able to make new friends. Like, at first, I could not even stand to defeat myself or to even boast about my ability. The mental health has impacted me with knowledge to boast about my strength. Like, I can say to myself, today is going to be a great day for me. My ideas are fruitful. I work with excellence, and I'm able to identify my weakness and potentials. I can able to contribute positively in my house, community, in my school, even in the classroom. I can boast about what God has given me. I don't look down on myself. I have self-confidence. My ideas are fruitful. I am going to be trying new things. Those are the positive affirmation of students our teachers gave to us, and I'm struggling to put it on and to meditate on it in every day of my life. So I advise other schools or friends, even in the house or in churches, in the community where they do not have mental health, they should endeavor to look for a solution, like talk to their principal, that they should try to talk to the mental health organization to at least help them to work with them and to advise them in their everyday life. And I'm also able to cope with everyday stress of life so that they can impact them with more knowledge. I also have a thank you message for the Grand Challenge Canada, because at first we could not have any access to enter any guidance counselor office, but now we have the access. We can even enter here and relax, and we can share our problems. We can even be friends to people who do not know. We can communicate with them, make new friends, and it's because of mental health. And this is the only club that have interest us and give us the strength that we can put on, that every Wednesday we can go for clubbing activities. Mental health is the only club that have given us the patience, the courage, and the strength to attend, and we are very grateful and thankful. At least we can be held responsible. We will not be like we are not taking part in any club in the school, and this mental health club has made us to be responsible students. Thank you, Grand Challenges Canada. Thank you, our guidance counselor, and thanks to the organizers of the Lifafa Research Foundation.
I am Lifafa Kinge Kange, the Executive Director and founder of Lifafa Research Foundation, and also the lead on the project promoting mental health amongst youths in the southwest region of Cameroon, specifically in Boya, Limbe 1, Tiko, and Mutengene. And so we have been carrying out this project for over 2 years now, where we've been able to work with young people in schools and in communities. And also we have been able to gather a lot of evidence in this project that we've been carrying out in the form of research data And this data that we've gathered has enabled us to be able to develop research articles for publication. We've published already 2 articles, and we are looking forward to adding more to our publication list. And we are hoping to use the evidence from this research and these findings to be able to advocate for policy, to be able to impact change. And so we intend to approach the appropriate authorities to be able to discuss these findings and to see how we can be able to influence change and influence policies that are geared towards prioritizing the mental health of young people in our schools and in our communities. And from these findings, we were able to actually identify a lot of issues that we think we need to share with our authorities, and so that this can help in decision making. And this falls in line with the vision and the mission of the Lifafa Research Foundation, where we are looking at being able to engage young people in research activities, engage young people in projects, and so that we can be able to collect data and use this data to be able to impact change. This should be done by young people, and so we've had a lot of engagement as far as young people are concerned in this project. And so we are saying that this project was a youth-led project to be able to address youth issues and to prioritize mental health of young people in our context. So we want to give acknowledgements to Grand Challenges Canada for funding this project, and other partners as well. And we continue to work together to see how we can enhance the sustainability of these activities through resilience building, through data collection, through counseling and other interventions that we think that are very, very relevant for young people in our context. Thank you.